Well, I recently had a conversation with Robert Lufkin, MD, and he wrote a book called "Lies I Taught in Medical School," and I don't believe that any of us are maliciously trying to tell lies. It's just whatever works for me, might not work for somebody else, kind of thing. And then somebody could say I lied about, the whole keto diet and whatnot. So, um, if we do shift gears a little bit, what are your thoughts about intermittent fasting and low carb diets and things? Do you have like a hard stance on that, or are
Yeah, I
you pretty
do.
down?
So I know Robert not that well. I've talked with him a couple of times, and I've seen him on your show. Yes, I think lies in the sense of the term the way Robert uses it. Now, and Ken Berry uses it sometimes in a similar fashion, sometimes with a little bit more dark shade to it. But it's a very common term, especially on YouTube.
Sure.
Ken's book was Lies My Doctor Told Me.
Yeah.
So, um, to your point, in the beginning, before I got too deep into this, um, I was concerned about the keto diet as well. The deeper I've gotten, the more concerned I have about people that are not on a low carb diet. Clearly recommend a low carb diet, and that can go from many different places to a very, very mild low carb diet, 100 grams of carbs or less per day, to more of a very low carb, 50 or less or 20 or less, to more of the classic keto, which is more of a high fat, low carb diet.
Mhm.
I would much rather, the vast majority of my patients are on these, vast majority is in over 95%. And that
Wow.
goes not just, people assume a lot of people assume that that's just animal products. I've got a lot of carnivores. I've got a lot of ketovores in my practice, but I also have vegetarians and vegans. And it's very interesting to talk to some of my patients because some of them have flip flopped many times between uh, pure vegan on one end of the scale and pure carnivore or even lion diet on the other. And it's interesting to talk to these people. It reminds me of a conversation that I had with Robert Lustig, also a physician, also deep into um, diet and health. He ran the obesity unit at UC San Francisco, um, also way deep into low carb diet. His perspective, and I think it's exactly right. It's mine as well. You can have a healthy diet on um, keto, carnivore, lion, uh, paleo, um, vegetarian, vegan, all except for one diet, and that's the standard American diet. And the problem with the standard American diet is it pairs uh, fats with these major sources of extremely glycemic, and pardon me for using that term again, but again, something that raises your blood sugar. Glyce meaning glucose, and emic meaning in the blood. So it raises the glucose in your blood. Putting that together with high sources of calories like fats, and when you raise your blood sugar, your insulin goes up. When you raise your insulin, it is difficult for your body to burn fat. Most of us, our metabolism was built to burn more on fat than carbs. It burns both, and it's very good at switching back and forth until we start to get metabolic disease. Metabolic disease starts with our insulin receptors. They become less and less receptive to insulin. Now, what is an insulin receptor and what's insulin? An insulin receptor is a part of your body which takes the glucose out of your blood where it can cause damage and puts it into the the cell, the liver or the muscle cell where it's safe and it's not gonna cause damage anymore.
Wow.